Good evening. Today is Wednesday, April 8, 2020, and this is Coronavirus Update by Heerak. My name is Heerak Christian Kim, and I'm running for U.S. Congress in Virginia's 8th District as an independent candidate for the general elections, which is on November 3rd, 2020. And I've created this program for you so that you can learn about coronavirus and that this show will help you survive coronavirus. We don't know how long we're in for, but some say it may last over 18 months. We just don't know yet. Many people don't really know much about the virus. So we're learning new things every day. And scientists may come to understand coronavirus fully in about 10 years or more. But it's a new virus, so not many scientists can say anything definitively about it. In today's show, I will explain to you what nurses there are, because you hear a lot about nurses on TV, but you may not know much about nurses. And as a Master of Science in Nursing student at Georgetown University, I can give you some insight into that. So let's start our program today. We're going to start with a daily update on COVID-19. Unfortunately, the trend is continuing. We had almost 2,000 Americans die yesterday in the last 24 hours before today, or before yesterday. And again, that is repeated, and in the last 24 hours, we have almost 2,000 deaths as well. So in the 48 hours, we have about 4,000 Americans dying. You could always go back to yesterday's program for the specific numbers. And you can subscribe to my YouTube channel so you can be updated every time a new program pops up. So in 2 days, there have been about 4,000 Americans, close to 4,000 Americans dying from coronavirus infection. In the last 24 hours, we had 1,875 COVID-19 deaths. And that's a 15% rise in terms of total number of deaths from yesterday's tally. So yesterday, the total number of deaths in the United States was 12,893. It went up 1,875 in the last 24 hours. And the total deaths from coronavirus infection in the United States of America now is at 14,768. That's a lot of Americans. And if we go at around 2,000 people dying every day, that's 10,000 Americans dying per week. In a 30-day period, that's about 60,000 Americans dying. And it may still increase. That's the problem, because it was only a few days ago that average number of Americans dying was 1,000 per day. Now it's around 2,000 per day. So in a few days, it could be 4,000 per day. And then a few days after that could be 8,000 Americans per day. We just don't know yet. But Surgeon General of the United States of America on Sunday said this week is going to be like Pearl Harbor. He was not kidding. If you go back and watch Meet the Press, full episode from Sunday, there were only about 88,000 Americans who were dead on Sunday. Look at the number now. It's at 14,768. So from around 8,000, 9,000 on Sunday, we have an increase of about 5,000 or more Americans dying just from Sunday to Wednesday. 5,000 plus Americans dying in 3 days. So this is what's happening right now. And so it is a source of big worry, because it seems like the number of deaths are doubling every few days. So if we have 2,000 people die tomorrow, it would have doubled from Sunday in 4 days. So in Sunday, we had like 8,000, several hundred deaths. And tomorrow, Thursday, if it goes to 16,000 deaths, the number of deaths have doubled from 8,000 to 16,000 in 4 days. Don't you think that's something of a concern? If it keeps doubling at the same rate, if it's 16,000 tomorrow, it doubles again in 4 days. By next Monday, we're going to have total number of 32,000 Americans dead from coronavirus. And if it doubles from there, then by next week, Sunday, we're going to have something like 64,000 Americans dead. Let's hope that it's not going to double. But the fact is, the number is basically close to doubling. Because on Sunday, it was 8,000, several hundred people dead from COVID-19. And we're almost at 15,000. And so this is the reality. Let's not sugarcoat it, because we do not need to lie to ourselves. We need to know the facts and deal with the problem and solve the problem, right? Total confirmed cases remain constant. Every day, about 30,000 new cases. So yesterday was 398,785 confirmed cases. It went up around 30,000 and a little bit over 30,000. And today, total confirmed cases in the United States of America stands at 431,838. Today, I thought maybe let's come back to the United States. Yesterday's episode, we talked about our neighbors, Canada, Mexico, Cuba, Russia, which is a neighbor of Alaska, and Greenland. So we looked at the coronavirus cases in our neighbor countries in yesterday's episode, and you can go back and watch that if you like. Today, we're going to just come back to United States and focus on United States. And today we have top 5 ranking. Top 5 US areas with deaths. So when we say top 5 areas, it's either a city or a county, because New York City is bigger than some counties in the United States. Number 1, deaths, total deaths, is New York City, and that's at 4,571 deaths. Now that's those deaths that are recorded at the hospital, and we don't know how many New Yorkers are lying around dead in their apartment. As people who have lived in New York know, there are a lot of people in New York who are alone and lonely. And they live in an apartment, some of them by themselves. Some may not have any friends. And basically they go to work and they go home. And at home, some of them don't have any friends. So their friends are kind of like in their work. And there are people like that in New York, probably in the thousands, maybe tens of thousands, hundreds of thousands, maybe even over 1 million people like that. And so it's possible that there are people lying dead in their apartment and no one knows about it, and their bodies are rotting away. So their death is not recorded because obviously they didn't go to hospital, and they're just dead in their apartment and their bodies are rotting away. Nobody knows. And that raises one question. Maybe New York City should find a way to kind of monitor that as well, because if we have dead bodies rotting away all over New York City in different apartments, some apartments are really run down, right? And decrepit. That could start another kind of disease. So maybe the mayor of New York and governor of New York may figure out a way to kind of see if there are dead bodies lying around in apartments, and then they need to kind of dispose of these bodies before a new disease starts. And there are a lot of mice in New York which can serve as vectors, spreading disease, right, if a new disease were to start. So that should be of health concern, I would say. I know a lot of people are focused on COVID-19, but there are other ways for people to die. Other diseases can start. Just because COVID-19 is here doesn't mean viruses and bacteria are just going to step aside. So that's something that I would suggest in my program officially to Governor Cuomo and Mayor de Blasio to look into. And hopefully they will take my recommendation seriously. I know that CNN, Fox News, ABC, NBC, CBS, the New York Times, Washington Post haven't raised some of the questions that I'm raising, which are important public health policy questions. And that's why this program is important. So subscribe to my YouTube channel. So rank 2 is basically in the suburban area near New York City, New York area, and they have 500 deaths. Number 3 is Wayne. It's a city in Michigan. They have 446 deaths. So Michigan came from behind, and now it's like number 3. Number 4 is Suffolk County. It's another kind of suburban area in New York, and it has 323 deaths. And hotspots are rising in different parts of New York, different counties, different suburban areas. So that's of concern. So we may see a hotspot growing and making it into top 5 list in the future. We don't know. Other cities in the United States may become a top 5. We have a lot of big cities: Chicago, Philadelphia, Los Angeles, San Francisco, Atlanta, Baltimore. So we have a lot of large cities which can suddenly become a hotspot. The 5th place right now is at Bergen County, New Jersey, 314 deaths. I know the 6th place is not shown, but it's in Illinois, over 300 deaths there. So things are getting bad in America, and it's probably going to get worse. So the Surgeon General of the United States, he's correct to say this week is Pearl Harbor week. We don't know what next week's going to be. Maybe next week will be more like Hiroshima or Nagasaki week. Let's see. Hopefully it won't get too bad. In the front line in the battle of COVID-19 are the nurses. And you probably have seen a lot of programs about nurses fighting without PPE, personal protective equipment, and there's a lot of protest among nurses about that. Nursing unions are complaining, nursing individuals are complaining. Number of nurses dying is going up. As I mentioned in yesterday's show, in 2 healthcare systems in Michigan, 2,200 healthcare workers are sick with COVID-19, and numbers are increasing all over the country. Deaths are increasing as well. But I thought, you hear nurses all the time, and I thought you may be interested in learning about nursing programs, because Maybe you want to become a nurse. Maybe your children want to become a nurse. And it's a good profession. You know, you save lives. Every day, the work that you do is saving lives. And that's one of the reasons why I've gone into nursing. Um, and I'm at Georgetown University doing Master of Science in Nursing now. And so it's a good profession. You know, every day you're saving lives. And so it's a good profession. I'm going to give you some information about different nursing programs in case you're interested. You could start nursing at any age. I've seen people start nursing after their retirement at age 55. There's no limit to when you start. So you may want to start nursing now after retirement, and more power to you. I'm going to give you information so you are aware of the programs. The cheapest program in the United States is associate degree in nursing. It's an associate degree, which means generally there are 2-year community college programs, and community colleges are finished generally after 2 years. So when you graduate from high school at age 18, by age 20, you're done with a nursing degree, which is an associate degree in nursing. And then you take the NCLEX RN exam, which is a nursing board exam, and then you can practice as a nurse. Generally, if you want to go into community college and start practicing as a nurse, it's recommended that during high school years, you take the prerequisite classes, because there are about, they can have anywhere from 6 to 10 prerequisite classes, which you can take in high school, like chemistry, biology, physics, mathematics. There are a list of courses. So you go to your community college and ask them, what kind of courses must my daughter or son need to take in high school to fulfill the prerequisites so he or she can start right away in associate degree in nursing? Many community colleges around the country are actually free. Some states have decided to pay 100% of the tuition, so you can get an associate degree of nursing for free in states that pay for your associate degree or community college tuition. And once you become an RN, your starting salary is generally anywhere from $40,000 to $100,000 a year, depending on whether you're working in a big hospital in a big city. And let's say you get an associate degree in nursing in a community college in Virginia, you could go to, let's say, New York at a big hospital and start being paid close to $100,000 a year at the age of 20, and that is possible. Once you have RN, you pass NCLEX RN, which you will take right after you graduate with an associate degree in nursing. You can start practicing at the salary level of an RN. Some hospitals still have RN programs or ADN programs, and they take 2 years, and their tuition is fairly cheap. Some places may give you some scholarship and it can be free. You can check around in your local hospital areas, their websites. You could go and ask them questions about it. And let's say your son or your daughter graduates at 18. She or he goes into this program in 2 years. By age 20, they're done, and they can start making money as an RN nurse. Average salary is like anywhere from $40,000 per year to $100,000 per year. So your daughter who's 20 years old can start making $100,000. They could always put in overtime. So it's definitely a possibility to make $100,000 at age 20 as a nurse. There are 4-year nursing programs, and these are called traditional Bachelor of Science in Nursing program. Georgetown University has a 4-year nursing program. And where I did my college degree, University of Pennsylvania has a 4-year nursing degree. UCLA has a 4-year nursing degree as well. Many colleges have 4-year nursing degrees. Georgetown, UCLA, University of Pennsylvania, you go straight into the Bachelor of Science in Nursing program. Some colleges you have to apply after 2 years because the nursing core courses are about 2 years long. So they go into a 4-year program like at Georgetown. You start nursing program, but the courses are spread out over 4 years. And then you take that with other classes that we fulfill the core requirements, and you graduate in 4 years. Some colleges, they want you to do the core requirements that are required of all students in the college in the first 2 years, and then just do nursing in the last 2 years. So that some colleges and universities have that system. Georgetown isn't one of them. Georgetown, you take nursing for 4 years, but you can also take other classes for 4 years. But in the other model, you do 2 years of just prerequisites and other courses, and then 2 years of just nursing classes. So look into the programs and see which programs you like. Now they have created some accelerated Bachelor of Science in Nursing, which they call post-baccalaureate or post-bachelor's degree nursing. And the fastest programs are 1 year long. And we can find one at George Mason University in Fairfax County. They have a 1-year accelerated Bachelor of Science in Nursing program. So let's say you graduated from Virginia, a Commonwealth University with a bachelor's in fine arts, and you thought you were going to be a great artist, but it is hard being an artist, and you say, I'm not going to starve to death. My parents are not gazillionaires, so I want to do something which is going to give me an income. And then I could paint on the weekends or during free times, and then become a great artist like that. But I need to eat and pay rent, so I'm going to go and become a nurse. And you can apply to George Mason University's 1-year accelerated Bachelor of Science in Nursing program. In 1 year, you're done. And then you can start working as a nurse. If you go to a big hospital in New York, do some overtime, you could easily make $100,000. If you do a lot of overtime in Virginia, you have to make $100,000 here. Excuse me. There are Master of Science in Nursing program, MSN program. That's the program that I'm in at Georgetown. And they generally take 2 years. And there are different types of programs. But we don't have much time right now. So maybe at another time, we'll talk about all the different programs that are out there. But generally, it's 2 years. And, whether you have a Bachelor's of Science in Nursing, 4-year, accelerated 1 year, accelerated 2 years, or you have associate degree in nursing or Master's of Science in Nursing. If you start out as an RN nurse, your salary is the same. You start out at the same level. So at Georgetown University, Master of Science of Nursing, tuition is about $100,000. Tuition and living costs and all that is about $100,000 a year. So most nursing students who don't have millionaire parents, they take out $200,000 loan for 2 years for the Master of Science in Nursing program. But if you go into associate degree in nursing, it's free. If you go to George Mason University and you're a Virginia resident, your tuition per year is fairly cheap. If you live at home, it probably costs less than $20,000 a year. So tuition is different at different places. It could be free in associate's degree in a community college, or you may pay $100,000 a year for 2 years for $200,000 at Georgetown. But if you start as a nurse, first time as a nurse in a hospital, you all start with the same pay, which is kind of an interesting system, but that's the system they have in the hospitals. So let's say you start out as a 20-year-old who graduated from community college in Virginia, which is a 2-year two-year associate degree in nursing, and you start out at a New York hospital, in a big hospital, you can get paid $100,000 a year. You could go to George Mason University in a traditional, or Georgetown University in traditional Bachelor's of Science in Nursing. You graduate around 22, and you may have borrowed a lot of money, especially if you went to a private university like NYU or Georgetown to do nursing, and your parents may have a debt that's, close to $100,000 or even more. Maybe your parents paid out of pocket nearly $300,000, and then you go to the same hospital. You'll make about 100,000. The same salary wherever you go. You start out, you're going to make the same salary as someone who has an associate degree in nursing, because both of you are RN nurses. And so, it may be smart, to be honest with you, to find a community college near your home, live at home so you don't pay rent, because rent can cost you $12,000 a year. And if you live at home, you just eat your mom and dad's food, so you don't have to pay anything. The parents don't have to borrow any money. And if the tuition is free in a community college, then you don't even have to pay tuition. So it's like 2 years of cheap study, no debt, and you start making $100,000. Whereas, let's say if you went to like a private nursing school like NYU, maybe you borrowed money and then you have now several $100,000 you have to pay back. And you're making $100,000, but every month you have to pay maybe $1,500 or so to pay back your student loans from NYU. So obviously it's smarter if you may want to go and have fun and have a college life, but it could be fun being a nurse making $100,000. You could stay in 5-star hotels, fly over to Paris once COVID-19 ends. You could probably have more fun as someone working, and you can get married and start a family early, and some of you may enjoy that better. It's different. People are different. But my recommendation is, if you are in high school now, go to a community college, which is either free or has cheap tuition. Fulfill the prerequisites in high school, starting in 9th grade. You spread them out, you get them done. You start as a nursing student, ADN nursing student. As soon as you graduate, maybe you could try to graduate earlier. Let's say you graduate at 16 from high school. At 18, you could be making $100,000 a year as a nurse. Isn't that smart? If you know what you want, if the parents are smart and can prepare their children in this way, it's kind of like an extended high school, right? You kind of guide your children and try to have them take summer classes or whatever, so they graduate from high school at 16. They live at home with you, and they just go to community college for courses. They come home. It may be a good way for you to kind of plan your children's future. At 18, they start working, and they could marry their high school sweethearts or whatever, somebody that they love from church. It's not a bad way to live. If you can start making at least $40,000, probably average about $70,000 a year, as soon as you're done with an associate degree in nursing at age 18. So it's not a bad idea to kind of have your kid graduate at 16 and get the nursing degree in 2 years. Start them off, that way. And they could even still live at home at 18 when they start working as a nurse, and kind of help out with the family as well. And so, that's my advice, actually. I think that's the smartest way for any family to go. But obviously, some families, and some high school students may want to go away to college. But, if you want to be a nurse, I think that's the best route. Once you have an associate degree in nursing, you could actually apply to a doctorate degree in nursing directly from associate degree in nursing. They call it RN to DNP program. Geez. So in a sense, why would you want to go to a 4-year bachelor's in science and nursing program and incur $300,000 in debt, that you would have to pay with interest for the rest of your life, when you could just get an associate degree in nursing, start working, making $100,000, and then you could, after a few years, apply for RN to DNP program and just get a doctorate. I don't know. For me, I would recommend that. I think that's a smarter way to go. But obviously that requires planning. And not all the parents in America are very concerned about their children or involved in their children's education or their future. And maybe this COVID-19 is bringing something good, because a lot of American parents in the 21st century have kind of become, dissociated from their children's lives. And this is very different from what America was like, 40 years ago, when parents were actively involved in their children's life. And when parents are actively involved in children's life, children have better chance of success in the future, right? You give too much freedom to your children who are 13, 14-year-old and say, oh, do whatever you want. How the heck are they going to know what they want, at 12 or 13, So, and, life flies by fast. 18 isn't that young, really, right? I mean, your body, they say, after 26, your body starts to degenerate. So it's biological. Your body peaks from like 16 to 20, 24, 25, and then starting 26, your body starts descending. Things start breaking down. Things start sagging and breaking down. And so it's not a bad idea to kind of plan your children's future in a way, because biological clock is ticking, and the mistakes of Generation X and Generation Y is they went to college, then they got a master's degree, and they went to graduate school. By the time they're trying to get married, they're like 35. And some of them cannot even conceive, because the prime time to conceive is like 18 to 26. So some women who went to graduate school for years and years, changed careers and went to graduate school, and then by the time they're 35, some women and some men are miserable. They're not married. They don't really have anything to show. They have like debt from college. They have debt from master's programs. They don't own a house. They may not even own a car. They may own a bicycle. But, so Generation X and Generation Y, millennials who have gone through that, it's a little bit sad, compared to the boomer generation or the generation before that. So, this COVID-19 time may be a good time for parents who are now at home with their high school kids or middle school kids, elementary kids, to kind of, spend the time to be parents, Let's face it, many of you are bad parents. I'm not trying to point fingers, but if you're not guiding your children's future, being a mentor to them, why should they have mentors who are strangers, right? Well, you know why there are mentoring programs? Because the parents are such bad parents now that your children need mentors, right? If you were good parents, your children will not need mentors, right? But these mentoring programs are developing because you are such bad parents. Not to blame you, but I thought maybe, speaking strongly will give you an opportunity to think about, self-reflect. Self-reflection is a good thing. You can be a good parent, and I want you to be a good parent. So, I'm kind of speaking a little bit strongly just to encourage you to think about and self-reflect and become the good parent that you can be. Become a mentor to your children. Do some research about college. Provide them with a pathway. And I am here to help you. So subscribe to this YouTube channel, because I'm going to give you some good advice that relates to all aspects of your life. Now, you see the photo, black and white photo, that's how nurses used to dress. Next to that, this is how nurses dress now. And this is a stethoscope that I'm wearing, and this is, you see it in the photo as well. So nurses generally, we wear this and we assess the patients. So if you get a COVID-19 and you come into the hospital, we'll use this to assess your lungs, hear your lungs and your heart, and I do that at Innova Fairfax Hospital, where I have clinicals now because of COVID-19. Things are a little bit different, but I was basically, wherever we are, we assess the patients with the stethoscope. I'm going to show you some other things that we use when we assess the patient. This is what we call the pen light. And we shine the light. And the way what this is useful for is we look at your pupil. We look into your eyes with this. We can also look into your mouth, your ears to see things are okay. So this is called a pen light. And nurses generally, have this. So this is like a standard for nurses. Most nurses carry it. And in the cardiac unit, if you're working in a cardiac unit in any hospital, you may have this. And this is basically what we use this for is when you have EKG, we measure the distance from one wave to another wave that show us whether your heartbeat is regular or irregular, what the problem of your heart is. So generally in a cardiac unit, when you have EKG, those things they put on your chest, on your without any clothing on, they measure your heart rate, and so we can see from that, and we use this, we print out a paper that records your heart activity, and then we measure. And so the cardiac unit, we use this, but it's not a standard feature for everyone. Now this, is a scissor. This is a standard nursing scissor, and you see how this is, it's not really pointy, because we don't want to injure the patients in any way. And the reason we have this scissor is we use this to cut your bandages. So let's say you have a car accident and a piece of glass penetrated through your chest wall, and that had to be taken out, and now you have a bandage there. The bandage needs to be changed, and the nurses come in and they cut the old bandage with this, and then they put a new bandage on if they need to use this. Now this is, some of you may have seen this, we hit your knee with this to see if your reflexes are working, but this can, nurses can use this to assess your reflex in different parts of your body. Your biceps can be assessed with this, triceps can be assessed with this, not just the knee. So this is generally used in physical assessment, but generally in the hospital, people don't use it. But in specialized units, maybe ortho units, this may be used. Now this is used to see if your hearing is normal. So you see how this is vibrating. So this vibrates. And then we put this like on your head. And so there are different ways to kind of to see how the waves or sound waves are conducted in your skull, and how your hearing compares to that, and so there are different ways to assess different parts of your body, and so they may use this in units that that may require that, ear, eyes, throat type units, and so so nurses can work in different types of units. They can work in an ortho unit that may use this to check reflexes. Nurses can work in a unit that emphasizes on head, ear, eyes, mouth cavity, and they may use this to test your hearing. This is standard, so everybody uses it, all the nurses. And this is generally for your electrocardiogram to kind of see whether your heart rate is normal. So no, I have to be honest with you, nursing is a very fun profession. I mean, I enjoy every time I go to the hospital and assess patients, and one great thing is you're saving lives, but it's actually really fun, using these things. I'm not gonna lie to you, it's really fun. So, it's fun and you're helping people, you're saving lives. So it's a good profession for your children. So you have to have a 13-year-old, 12-year-old. I taught eighth graders in Petersburg City public schools. I've talked about that in previous episodes as a math teacher. And I've encouraged some of my students, back then to go into nursing because, as I said, if you get a associate degree in nursing, you could be 18 years old or 20 years old or 40 years old. It doesn't matter. The first year you start out, you could be making anywhere from $40,000 a year to $100,000 a year, depending on the city or the hospital. So, Petersburg City public schools, it's 99% African American school, and it's considered one of the poorest cities in Virginia. The school district is considered by some as the worst school district in Virginia. And there is a cycle of poverty. Generation after generation, there's poverty. One of my concerns is to help African American people in inner cities. And that's why I decided to go to Petersburg City Public Schools and teach math there. It's never been accredited. The school has never, ever been accredited in its history. So it's a very struggling school. So they need good math teachers, good teachers in every subject. So, in the students, in 4 classes that I taught, 2 of the classes had not a single student passing their math SOL in 7th grade. I taught 8th graders, and in Virginia, they take this SOL, Standards of Learning test every year. That's a state mandated test. State requires this math test every year of all 7th graders, the same exact test for all students. Many school districts, you have like 95% of the 7th graders passing this exam. And you see that a lot in Fairfax County, Arlington, Alexandria, Falls Church schools. You have 7th graders, they have like 95% of all students passing. In Petersburg City public schools, 7th graders in 2 of my classes, zero students passed their 7th grade SOL, but they allow them to go on to the next grade. And I had students whose math skills were literally at 3rd grade level. Like if I say, what is -3 minus 1, they can't do it, and they're 8th graders. And so I had to upgrade their math level from 3rd grade, 2nd grade level, all the way up to 8th grade. And I'm a very good math teacher. Actually an amazing math teacher. So I upgraded their level. Not all of them, but some of them to 8th grade from 2nd grade level. I had one student, she's an 8th grader. She was like 8th grader age. And she was like nearly 6 feet tall. And she got 100 on one of her tests. I mean, obviously the first set of tests, everybody flunked. And then I'm an excellent math teacher, so I taught them using my strategies. I'm working on a book right now to help inner-city African-American schools and teachers to teach in ways that can help them. After I worked my magic, this student got 100% in one of the tests. She started screaming and yelling. She jumped up on the table and started dancing because she was so happy. Students who get F, they are happy when they do well in school, and people think, somebody's getting an F because they're dumb. No, if students are getting F, it's the teacher's fault. I mean, sorry to make you teachers feel bad, but it is the teacher's fault because, they're students. How are they going to learn math by themselves? It's the role of the teacher to teach the students math. And I'm a darn good teacher, and so I upgrade students from 3rd grade level to 8th grade level in a few months. And so she was screaming and yelling, and the police officer, she worked for Petersburg Police Department, but she stayed stationed inside the school actually to protect the teachers. But anyway, and I guess, other people could come into the school as well. But so she ran into the classroom because she was afraid that I would get injured, or, I guess. Anyway, I love my students, but, these resource officers are police officers. So, they're a little bit jumpy. But anyway, so she rushed in. It's like, what's going on? And I'm like, there's no problem here. She got 100 on her test. She's just celebrating. And the police officer, she had like her hand in her gun, ready to go. But yeah, so I mean, that's not so isolated because I'm a great math teacher. I see that all the time, everywhere I go. And so I actually delivered a paper at 2019 convocation of International Honor Society in Education. And I delivered a paper on how we can teach math to inner city students in a way that is effective. And so my paper emphasized social emotional learning. So I'm actually an expert in that area. Since I was invited to give a paper on that, I'm a de facto expert because that's how you become an expert, right? You present your paper to other experts. And so, I'm kind of working that into a book right now. So that convocation was in Virginia. Every year it's different. This year it's going to be in Kentucky. So it's a once-a-year conference for all educators who are part of this International Honor Society in Education. And so I presented in Virginia, where the conference was in 2019. In November, I had a nursing class in the morning, and we had a presentation, a group presentation. So I'm presenting, and I was like, Professor Schloss, she's a nursing professor at Georgetown. I have to present a paper. Can we go first? And it worked out. As soon as I was done with our group presentation that presented with like 3 other nursing students, I drove down. Like I might have overspent, and it took me 3 hours to get down to the conference center, and then I delivered my paper. And it was very well received. And so yeah, so as I've shared in I guess previous episode, I'm the co-chair of the program committee of Virginia Council of Teachers Mathematics. Virginia Council of Teachers of Mathematics is the one that oversees all math educators from pre-kindergarten all the way to PhD programs. So all the universities in Virginia, George Mason University, University of Virginia, Virginia Commonwealth University, College of William and Mary, all the universities in Virginia, all the math professors, that's our domain, we're Virginia Council of Teachers of Mathematics, and that so we provide guidance on how they can teach math better. Yeah, so I'm an expert in math as well, but making a world a better place, and nurses make a world a better place. And I firmly believe if we can encourage more middle school students and high school students to become nurses, I think they will be happier. A lot of parents, as I said, a lot of American parents are really bad parents, I'm sorry to say, because they're like, oh, you do whatever you want. And you tell that to like 12, 13-year-olds, how are they going to know what they want? I mean, no guidance, like such hands-off kind of a parenting. It's like easy for the parents because they do no work. And they want like their children to find like a peer mentor when it's the role of the parents to be the mentor. And that's one of the biggest problems in America today, is too many parents are too hands-off. They're like, you decide. It's kind of like, have you ever gone on a date and both of them are like, oh, you decide which restaurant we're gonna go to. You decide. I mean, that's probably the most frustrating thing for somebody on a date when you're trying to figure out which restaurant to go. You're like, someone decides so we could go and eat. We're starving. It's kind of like that, with children. They need guidance, and the parents have to be better parents. I'm sorry, but too many of you are bad parents, and that's one of the reasons why a lot of the children don't turn out well, because you're bad parents. And hopefully through this COVID-19, you will take your responsibility, discuss with your children options that they may have, start preparing. It's not too early to prepare for future. I would say you should start around age 9 or 10, because by 18, you should definitely know what you want to do. I mean, your biological clock, at age 26, you're physically starting your decline. And so, ideally, you probably want to be married somewhere between 18 to 24. I mean, from a biological standpoint. And so some people do. I have friends, I've known people who got married at age, 18, high school graduates who started working at 18, didn't go to college, they got married at like 19, and they're very happy. And now they're like managers of, companies or factories where they work. And so they're making good money, not right now because of COVID-19, but they were. And so, yeah, I mean, your parents have to be better to give children guidance so they can have happier lives. But anyway, so I would say seriously consider researching your schools in your neighborhood, your area. If they go to their community college from your home, they don't have to pay for dormitory. They don't have to pay for food because they could munch up your own food. You're not going to go into debt because if your kid goes to, let's say, NYU, you have to borrow money to pay for that stuff. I mean, geez, with COVID-19, how are you going to pay for any college for an average American middle class family? So this is a good time to look at the community colleges in your neighborhood, because you may not be making any money. You may be on unemployment now. If COVID-19 continues for 18 months, geez, you may have to file for bankruptcy. You may foreclose on your home, for God's sake. And so, some community colleges you could probably start in the summer, because some community colleges are having online courses. So yeah, your children, register for some online courses. If your child is like a 10th grader, 11th grader, 12th grader, they could actually take community college classes online. And Liberty University in Virginia has good online courses as well. They're a little bit more expensive than community colleges, but it's a good college. And so explore your options. Don't waste the summer. If your kid is a 10th grader, your 10th grader kid can take an online class from your local community college and start piling up college credits. Start working toward that nursing associate degree in nursing program at your local community college. So get on it, because it's almost May, right? They could probably even apply now. Now that they're home, they could actually start summer classes in local community college if they're offering it. And I think the first summer session starts like in May, mid-May, and the second summer session starts around July. So I mean, you could take some nursing class, nursing major prerequisites. So look into that. Be good parents. This is Heerak Christian Kim, independent candidate for Virginia's 8th district. That's Arlington County, City of Alexandria, City of Falls Church, and parts of Fairfax County. And I created this COVID-19 program to meet the need of cura personalis, your complete need, not just you and the COVID, the virus, but you and the COVID and your children and your family and your children's future, your family's future, your role as parents. I am going to cover everything and make your life better. I'm going to give you guidance so that you can be a better individual in society, contributing to bettering of United States of America as a country, and bettering of your children's futures and your family. So keep tuning in, subscribe to my channel, and don't forget to vote for me on November 3rd, 2020, the general elections. I'm running against Don Beyer, who is a Democrat incumbent U.S. congressman right now in this area. So look for my name, Heerak, Christian Kim, and tick that box. And I'm going to lead you and state of Virginia and the rest of the country into a better future. I hope that you will be well and that you will survive COVID-19 and thrive thereafter.